Yeah.
Squat down. That was your biggest problem before.
I was supposed to keep my knees down.
Yes.
Oh, yeah, oh man.
Holy cow!
Oh, yeah.
Hi, this is Dr. Robert Davis with Active Health Knee and Shoulder. I'm here with Jack, and Jack has gone through his non-surgical operation with us for his problem knee. Jack was kind enough to come on and just explain the problems that he had prior to finding us, and then the results that he noticed when he finally came into the office. So could you just tell us the problems that you're having, why you sought us out, the experience in the office after you had the procedure done, and what you were told, if you can remember all this, what you were told by other doctors. So the problem first.
Yeah, this has been long-term for me, probably going on 8 years now. I've been getting injections for a lot of years from 2 different doctors. Initially, they were lasting a good year and were very effective. And then they became less effective. And then the doctor was reluctant to give them to me. They were becoming less effective. And then he told me the knee's basically shot. It's time for replacement. And then I retired, and because of health insurance, I sought out different health insurance and had to see a different doctor. And same thing, he gave me a few injections and they were not so effective. He says the knees, it's time to replace it. And I was down here in Florida, and
Right.
I
Found us.
Yeah, found you guys, and says, hey, you got nothing to lose. I'm going to check this out.
Does it feel different? Which feels different?
Just feel free.
I feel free. I'm free. Let's go up and down the stairs now, okay? Look at that.
Yeah.
And back up the stairs. All right, Jack, how are you feeling?
Wonderful. It was just amazing. And this past weekend, my son and
Grandkids.
yeah, grandkids down, 6 grandkids, and yeah, it was grandpa this, grandpa this, grandpa this. And I was just nonstop, ball energy, just having a ball with them out on the boat and in the pool, and yeah, it's just amazing. And got my life back. Yeah.
Fantastic.
Yeah.
Yeah, because I remember your big complaint was being able to just go walk on the beach and just enjoy being down here in Florida and the grandkids, keeping up with them. So I'm so happy for you. It's fantastic.
Yeah. Thanks.
Thanks for coming in.
Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes, and I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?
This is the real deal.
Hi, I'm Dr. Robert Davis with Active Health Knee and Shoulder, and I am here today to explain how our non-surgical operation has helped hundreds of people who were previously suffering with chronic degenerative knee pain. Many of the patients that come into our office have been suffering for a long time with knee pain. They've attempted the injections, they've taken the drugs, they've had various different therapies, all done with little to no improvement. This leads their doctor to tell them that they have bone-on-bone degeneration and that their only option is to have their knee replaced. Well, I'm happy to tell you today that we do have another option. Our non-surgical operation is a neurological treatment system that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and flexibility, increasing blood flow, and assisting in tissue healing. You see, there are 2 different nerves that are associated with the movement of your knee. One is your sciatic nerve, which branches off the bottom of your spine and runs directly into the muscle that unlocks your knee. This muscle is attached to the upper bone in your leg and the lower bone. It's called the popliteus muscle. The other muscle is the other nerve is your femoral nerve. And your femoral nerve is what powers your quadricep muscles. So every time you take a step, when you reach forward with your leg or with your foot to take a step, that femoral nerve is firing so those muscles do their job. If there is interference or if there is static along the pathway, right knee is controlled by the left side of your brain, but if there is some type of lesion or interference along this pathway, what happens is you're going to lose tone. There's going to be a state of hypotonicity. Your knee needs to unlock before it bends. If it doesn't unlock properly because there is a lesion or static along this pathway, then the bones are going to shear together. When bones shear together, that doesn't feel good. They're going to cause chronic degenerative pain, and they're also going to put stress on the supporting structures that are supporting the knee and keeping the strength of the knee. So what we do is a non-surgical operation that resets the communication between your brain, the power from your brain running down the spinal cord and getting to that knee. And that restores the strength, it restores the flexibility, it decreases pain and inflammation, and it assists in tissue healing. So if you or a loved one are suffering with chronic degenerative knee pain and you've tried the injections, you've taken the drugs, you've had the therapies done, and you still have little to no improvement, I encourage you, give our office a call. We will do a complete neurological examination for only $60, and I will be able to determine within 2 visits whether you are a good candidate for our non-surgical operation. God bless you. I look forward to meeting you, and I look forward to helping you.
Lee, let's talk about those knees. How long have you had the knee problem?
A little over a year.
Okay, have you seen any other doctors?
I've seen an orthopedic.
And what did the orthopedic do or say for you?
They repaired the meniscus in my right knee and said I have bone on bone. And the left knee he hasn't touched, but it's doing the same thing as my right knee used to.
And then he has told you bone on bone? And what is his decision to do with bone on bone?
He said eventually I'll want to have a knee replacement.
In both knees?
He hasn't said that on the left knee yet.
Okay. So what kind of challenges are you facing with the knee problem?
Well, I'm newly retired and I want to be able to travel and play with the grandchildren and just be more active because I now have the time.
Right. And you want to be pain-free. And you want to be able to do it and stay active. Well, you're at the right place. All right, so your discomfort level today we discussed from 0 to 10?
Yeah, it's probably about a 5 today.
Okay, and are you normally taking some kind of Tylenol or Advil or something?
I take Motrin a couple times a day.
A couple times a day, and you're taking it every day?
Yes.
Okay. All right, well, we got to get that so you don't have to take that any longer too. All right, Lee, I'm going to have you stand up for me. Any discomfort or any tightness or anything when you go from sitting to standing?
Not so much, no.
All right. I'm going to have you take 2 steps forward. There you are. Feet shoulder length apart. Arms straight out in front of you. And I'm going to have you squat down as low as you can go. And slowly come back up. Okay, where did you feel it there?
The top of the knees.
The top of the knees. Okay. All right, so next thing I'm going to have you do is go up and down the stairs for me. And turn around and go back up. Okay, so going up and down the stairs, which was more difficult for you, going down or coming up?
I think they were about equal.
About equal. And where were you feeling the pain and discomfort?
On the outside
On the outside
of the knee.
of the knee. Okay, so out of all the exercises, which one was the most difficult?
Stairs.
The stairs. The stairs was the most difficult for you. All right, you ready to get started?
Deep breath and up. Go 1, 2, keep pulling 3, 4. Hi, it's Dr. Robert Davis here with Active Health Knee and Shoulder, and I'm here with Lee, who just completed her non-surgical operation and her aftercare. So I just wanted to ask her a couple questions about her care and the problems that she had, and just to get an idea of her overall feeling of the experience here. So Lee, can you tell me the problems you were having before you came in? Like, what was going on with you? You had problems in your Your knees and low back?
Yep, my knees, I was having trouble walking. I was
Right.
afraid to walk through the airport, the inclines, stairs. I was icing every night. I was in a lot of pain, and I'm too young to have that much
Right.
pain.
What did you try? What did you seek out as far as to resolve the problem?
I went to the orthopedic. They did injections in my knees, both knees, and they worked for about 2 months. I went for injections again. They really didn't work. So the next step was surgery.
Okay, so when you came into my office, you were at a fork in the road, and you were either going to have surgery done, and what type of surgery were they recommending?
Knee replacement.
Oh wow, okay. And so you ended up in my office, and what was your experience? Let's go through the second visit after I did the evaluation. You had the procedure done.
Immediately I was feeling relief. It felt looser. My knees felt looser, like I could move them. And that was immediate.
Right.
And that was just the start.
She's smiling. How you feeling?
Awesome.
What changes have you noticed?
It's loose.
It's loose. You don't feel as tense and
No.
tight?
No.
How's the pain?
None.
I know you feel good, right? There you go. That's awesome.
I do.
That is awesome. Okay, let's go up and down the stairs. That was your biggest challenge, was up and down the stairs. And look at that. How are you feeling?
Better. Better. Yes.
What is the biggest thing that you notice about after Dr. Davis has done his non-surgical operation? What is the biggest thing that you're noticing?
I feel looser and more stable, actually.
So you feel like you're almost stronger.
Yes.
Perfect. That's exactly what I wanted to hear.
So then tell me some of the activities you took on that you weren't able to do for a while. What did you do within the first few weeks? Not my recommendation, but she
I
went
went
for it.
jet skiing. And I'm able to walk as much as I want. I do a lot of biking. I golf a couple days in a row, which I wasn't able to do before. Even just swinging the club was hurting my knees.
Right.
So I'm a happy camper.
Excellent. And what would you tell people that, somebody like yourself that is facing, has been to the orthopedic surgeon, they've been told they need surgery, what type of advice would you give to them?
Come here.
Okay.
How long have you had the pain, Ann?
It's been probably a year and a half.
And was this something that just gradually happened?
I believe it was the result of an injury I sustained in the past.
Okay.
I had a fall 4 years ago, broke my left knee.
Broke it?
I fractured the tibial plateau and shattered the meniscus.
Wow.
It's been a twist on the right knee that was unknown at the time because this was so significant.
Right.
And then also where I have worked, it might have been a bit of a work injury, working with patients. It was a difficult psychiatric patient that needed medications and restraining. It was a lot of us as staff involved, and it was a difficult sort of, if you want to call it, the takedown.
Wow.
I did end up on the floor. I did not think I was hurt, and I really wasn't, but I may have continued to cause more aggravation in the knee that I didn't really realize. And it was shortly after that that there was more significant discomfort in the knee, and it's progressed.
And you have pain in both knees, correct?
I do not have pain in the left knee at this time.
Just the right knee?
Correct.
Okay. All right. So I know we had discussed earlier your pain level, your discomfort level today, and you had stated that it was
It's about a 6.
About
There's
a 6?
Pain in the sciatic nerve.
Okay.
Running down into the knee, and then the biggest pain is on the inner aspects.
Okay. All right.
The right knee.
Have you seen any other doctors for this?
In July, I had arthroscopic surgical procedure done because there was torn meniscus, which may very well have been from the fall. And he also took out some arthritis. Just did like a scoping.
Okay.
And at that time, I also have a Baker cyst that's good size from the irritation that's in there
Sure.
and some ligament bruising.
Okay. But the surgery didn't help?
It did help. It did help some because he repaired the meniscus, and by taking out some of the arthritis, it has helped. However, the pain continues down the leg and up into the sciatic nerve.
Okay. All right. Well, we got to get you feeling better. All right, Ann. I'm going to have you stand up for me.
Okay.
Any discomfort when you did that?
When I have the pressure on the knee, yes.
And could you point to where the pressure is?
It's all through here.
All on the inside.
Yes.
Okay. All right. So standing there, feet shoulder length apart, arms straight out in front of you, heels stay on the ground, and squat as low as you can.
Well, I'm hitting the bench. Come out some. Okay.
Okay.
It starts getting hard right about
Right there, okay.
And it hurts the sciatic nerve as well.
Okay. So you're feeling it in your low back, and
Yep.
where are you feeling it on your knee?
Through here.
Right through there. That seems to
Yep.
be your hot
That's-
spot.
That's my spot.
Okay. All right. I am going to have you walk up and down the stairs for me if you could. I want you to hold on to the railing.
It hurts like that.
Okay. Is it so it's when it's bending?
It's the bend.
Okay.
Right in there, when I go down on the bend, right there.
Okay. Perfect. That's exactly what we can pinpoint that so
Yeah.
we know exactly
It's
what group of muscles it
Very
is.
specific right there.
All right. We're going to go back up the stairs.
Right there. It's the catch right there.
So it's when it's bending. Okay. Not when the weight is on it, but when it's
Right about
bending.
above Bending in the push up.
The push up.
there.
Okay.
Yep.
All right. So, Ann, out of all those exercises we did, which one causes you the most discomfort? Going up or down the stairs?
Probably going up.
Up the stairs?
Probably more
So, like
up.
when you were doing that push up.
Push up. It's the
Okay.
push up.
Okay.
Yes.
All right. Let's get you in to see Dr. Davis and get you feeling good today.
I am going to some pressure. Okay. You take a deep breath and pull your knee up. 1, 2, 3, 4. Keep pulling. 5, 6, 7. Good.
I get it now.
Deep breath and pull. 1, 2, 3, 4, 5. Keep pulling. 6, 7. Good. Hold that. Nice deep breath and pull. 1, 2, 3. Keep pulling. 4, 5. All the way. 6, 7. Good. Deep breath and pull. 1, 2, 3. Pull that knee up. 4, 5, 6, 7. Good. Do 2 more right here. Deep breath and pull. 1, 2, 3. Pull. 4, 5, 6, 7. Deep breath. Pull. 1, 2, 3, 4, 5, 6, 7. Dr. Robert Davis is Active Health Knee and Shoulder, and this is Ann. And Ann came to see us at, I believe it was last week, right?
It was
That was
last,
your first procedure?
well, Monday we had a consult,
Right.
and Wednesday was the review of my
Uh-huh.
x-rays and treatment number 1.
And so one of Ann's complaints was that she had a Baker's cyst and she wasn't able to walk properly, navigate stairs and things like that. So can you give us a little update on the Baker's cyst? Let me briefly explain what a Baker's cyst is. A Baker's cyst is accumulation of lubrication fluid behind the knee in what's called the popliteal fossa behind the knee. And it is a response to the knee not working properly. It can be arthritis, a number of different dysfunctions in the knee. So your knee is supposed to unlock before it bends, but if it's forced to open up, it will start to shear, and then you'll get fluid that will build up behind the knee and it forms a cyst. So what we did with Ann is we did a reset of the unlocking of the knee with the popliteal muscle. And can you just explain what you've noticed in the last week with the Baker cyst?
Absolutely. The cyst was approximately 7 centimeters in size. I could feel the stiffness and tightness behind the knee, causing me to even be more immobile, and the knee was just bent continually. I could not get good straightening of my leg. I felt twisted out of alignment. So after treatment number 1, and I actually could feel something. I didn't know what Dr. Davis was doing, but I felt it. And then I went to some other of the treatment areas, and my pain was probably a 6 coming in. I walked out as a 2, and had treatment number 2 the next day. Again, the pain was decreased even more, down to a 1, and continued treatments at home with exercises. We are now at Monday, and the pain is like a 1 to almost a 0, and the cyst is, I can't even, maybe it's down to maybe a couple centimeters softer. My knee mobility is so much better. I'm walking straight, and I have like really no pain in the knee. Really no pain.
Excellent. So the reason for that is because now the knee's doing what it's supposed to. It's unlocking, so it doesn't need that extra lubrication to try to lubricate the joint to move properly. Okay, fantastic. Thank you.
All right, we're back with Ann. Ann's finished her first treatment with Dr. Davis, so let's see what you can do. Stand up for me. How was that?
A lot less pressure, less pain.
All right, let's see your squat.
Pain.
Remember, step up a couple because you can squat pretty low.
The pain in the knee is unbelievably better.
Because you were a 6 when we
6,
started. What do you think it is now?
6. 1 to 2.
Okay, perfect. Let's go up and down the
I'm saying
stairs.
this shockingly, but like 1 to 2.
I'm not shocked because I know it happens. All right, go up
Okay,
and down the
here we
stairs for
go.
me, Ann.
Oh my God. Oh my God. It's crazy good.
That's crazy good. Let's go back up. Let's go back up.
This is where the pressure would hurt.
This was the most painful.
That's maybe a 3.
Okay. It was a 6, but now it's down to a 3.
2 to 3.
Okay.
2 to 3.
All right. So what do you think, Ann?
Well worth it.
Well worth it?
Absolutely. I was told to get a total knee by many people.
And today you're going to walk out feeling really good.
I
with,
am.
with less
Yeah,
pain.
Absolutely.
We haven't even done therapies yet. Wait till we start with therapies.
This is amazing. It's amazing.
We're here today with Madhu, and Madhu is here to get his knees fixed. So tell me a little bit about what's going on with those knees. How long have you been in pain?
Give and take, my right knee is maybe 10 years, left knee started about a year or so ago.
Wow.
And this is stopping my mobility and freedom to stand up and walk.
Right.
And especially if I want to bend down on the floor.
Sure.
To pick it up or something or say I'm unable to do very discomfort.
So your normal activities is really holding you back?
Correct. That's correct.
Have you seen any other doctors for this?
Chiropractors I continue to go, but not orthopedic surgeon, no.
Okay, so you're looking to find the cause of the problem and fix it?
That's correct.
Without surgery or injections or medications?
Yeah, I don't believe in surgery or medication either. I just take aspirin, things like that.
Right.
Because I want to, find out that if I can do that without operating or opening up, things like that. Yeah.
Absolutely.
Yeah.
So let's talk about that discomfort today. We had discussed earlier from 0 to 10. What is your discomfort today?
Today about 7 or so.
Okay.
Yeah.
Okay. I'm going to have you do a couple different exercises for me. So if you could just stand up for me.
Okay.
Now, where did you feel the discomfort when you did that?
Right here, both knees and here.
And your low back too?
Correct.
Okay.
Yeah.
So in both of those knees, was it on the outside part of the knee?
This one outside, but this one kind of as a whole.
As a whole thing?
Front, yeah.
Back and the front?
Back and front.
Okay.
Totally.
All right. I'm going to have you take 2 steps forward. All right. Feet shoulder length apart. Arms right out in front of you. And I'm going to have you keep your heels on the ground, squat down as low as you can go.
That's it.
Okay, come right back up. Now, where did you feel that discomfort there?
Both knees.
Both knees?
Sharp pain.
Okay, so it was like a stabbing pain that you were getting.
Correct.
Okay. All right, so now I'm going to have you go up and down the stairs. So make sure you hold on to the railing. All right, and we're going to go back up the stairs. Okay, so which was more difficult, going up or down the stairs?
Pretty much same, but going up is a little bit more because I feel that sharp pain here, even outside.
On the outside, and that's what was going down the calf, right?
Correct.
Yeah, so you start in the outside of the knee and then works its way down.
With more pressure.
Okay.
Going down, you feel in the knee overall, but going up, you feel that.
Right. So out of all of those exercises, which one caused you the most discomfort?
Going up.
Going up the stairs?
Yeah.
All right, so you ready to get started?
Yes.
5, 6, 7. Release it. Keep the knee locked. Deep breath. Press. 1, 2, 3, 4, 5, 6, 7. Release.
What changes have you noticed?
A little bit more ease, and when I'm lifting my knees,
Right.
I don't feel any pressure.
So they're easier to bend?
Correct.
They're easier to bend?
Yeah.
And a little bit smoother. I'm gonna have you stand up for me.
Okay.
How was that?
A little better.
Well, how would, I know, because you said that you felt a little bit in low back. How does that feel now?
I don't feel that bad. Yeah.
Good. All right. So that's awesome. Take 2 steps forward. Feet shoulder length apart. Arms out in front. And I'm going to have you squat down. Whoa! Holy smokes! That's great! Oh, he's like, I got to do it again. Are you showing off? All right, let's try the stairs.
Yeah, maybe a little pain, but I could bend down.
Yes, you could. Oh, and look at that, with just ease. Back up again.
Yeah, no, I don't feel no pain at that time. Yeah.
That is great.
Let me do it one more time.
Okay.
Good. Yeah. It's definitely better. Yeah.
That's awesome. So what have you noticed? What's different?
Well, before I sharp pain, now I don't feel sharp pain.
Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes. And I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?
This is the real deal.